Assalamu alaikum. Greetings to you all. In this video today, what I'm going to do is I'm going to read a paper, a scientific paper, and the title of this paper is Press Pulse, a novel therapeutic strategy for the metabolic management of cancer. This paper was the result of research conducted by Dr. Thomas N. Seyfried, George Yu, Joseph C. Maroon, and Dominic P. D'Agostino. So in this first video, I'm going to read the abstract. The abstract has got few sections, and I'm going to read that. And in a follow-up video, I'll read the rest of the stuff. So let's start. Abstract. Background. A shift from respiration to fermentation is a common metabolic hallmark of cancer cells. As a result, glucose and glutamine become the prime fuels for driving the dysregulated growth of tumors. The simultaneous occurrence of press pulse disturbances was considered the mechanism responsible for a reduction of organic population during prior evolutionary epochs. Press disturbance produce chronic stress, while pulse disturbances produce acute stress on populations. It was only when both disturbances coincide that population reduction occurred. Methods. This general concept can be applied to the management of cancer by creating chronic metabolic stress on tumor cell energy metabolism. On tumor cell energy metabolism, that means press disturbance, that are coupled to a series of acute metabolic stresses that restrict glucose and glutamine availability while also stimulating cancer-specific oxidative stress, pulse disturbances. The evolution of non-fermentable ketone bodies protect normal cells from energy stress while further enhancing energy stress in tumor cells that lack the metabolic flexibility to use ketone as an efficient energy source. Mitochondrial abnormalities and genetic mutations make tumor cells vulnerable to metabolic stress. It should say actually vulnerable to metabolic stress. Results. The press pulse therapeutic strategy for cancer management is illustrated with calorie-restricted ketogenic diet, KDR, used together with drugs and procedures that create both chronic and intermittent acute stress on the tumor cell energy metabolism while protecting and enhancing the energy metabolism of normal cells. Conclusion. Optimization of dosing, timing, and scheduling of press pulse therapeutic strategy will facilitate the eradication of tumor cells with minimal patient toxicity. This therapeutic strategy can be used as a framework for the design of clinical trials for non-toxic management of most cancers. Because this abstract part is pretty short, what I'm going to do is I'm actually going to read a bit more. So let's read the background part. This is outside the abstract. This is just the background of this research work. Background. According to paleobiologists Aaron and West, the simultaneous occurrence of press pulse disturbances was considered the mechanism responsible for the extinction of organic populations during prior evolutionary epochs. Reference 1. A press disturbance was considered a chronic environmental stress on all organisms in an ecological community. The press disturbance promoted extinction through habitat loss, reduced reproduction, and restriction of range and resources. Press disturbances would force a biological community into a new equilibrium where previous important species become non-viable. A press disturbance would shift the adaptive landscape to favor the fittest species while eliminating the weakest species. In contrast to the press disturbances, pulse disturbances were considered acute events that disrupted biological communities to produce high mortality. Reference 1. Though extensive mortality in the immediate aftermath of the event, a pulse disturbance could cause extinction. However, survival of some species could occur following a pulse disturbance as the physical and biotic environments would eventually recover to their pre-disturbances equilibria. Reference 1. It was only when both the press and the pulse disturbances coincided that mass extinction of species without recovery was possible. We described how a modification of the press-pulse concept can be adopted as a therapeutic strategy for the possible eradication of tumor cells. The press-pulse concept should be best considered in light of current views on the origin of cancer. The origin of cancer. Cancer is a systemic disease involving multiple time and space-dependent changes in the health status of cells and tissues that ultimately lead to malignant tumors. Reference 2. Neoplasia involving dysregulated cell growth is the biological endpoint of the disease. Reference 3-4. Tumor cell invasion into surrounding tissue and their spread, which also known as metastasis, to distant organs is the primary cause of morbidity and mortality of most cancer patients. Reference 5-9. Data from the American Cancer Society show that the rate of increase in cancer deaths per year, which is 3.4%, was twofold greater than the rate of increase in new cases per year, which is 1.7% from 2013 to 2017. Reference 10 and 11. Indeed, cancer is predicted to overtake heart disease as the leading cause of death in Western societies. The failure to clearly define the origin of cancer is responsible in large part for the failure to significantly reduce the cancer death rate from the treatments and in developing cancer prevention strategies. Reference 12. Cancer is generally considered a genetic disease where random somatic mutations underlie the origin and progression of the disease. Reference 4:13-16. The general view is now under serious consideration in light of major inconsistencies with the gene theory. Reference 2, 3, 12, 14, 17-24. Emerging evidence from cancer genome projects show that most malignant tumors are remarkably heterogeneous. Reference 2, 15, 16, 25-27. This degree of heterogeneity will confound attempts to exploit genomic defects for effective therapies. Moreover, the majority of genetic mutations are considered downstream epiphenomena of dysregulated energy metabolism. Reference 2, 20-28. In contrast to the extensive genetic heterogeneity seen in tumors, most, if not all, neoplastic cells within the tumor share the common metabolic malady of aerobic fermentation that arises ultimately from dysregulated oxidative phosphorylation. Reference 2, 17, 29-33. In light of these findings, cancer can also be recognized as a metabolic disease. In this video, I'm going to stop here, and in a following video, I'm going to read the next bit, which is the methods that they used to conduct their research. So I hope to see you in the next video. Take care. Bye-bye.